what is it and why is this increase happening? If there is a something that is to be concerned about, and it was seen that strokes was something which the elderly had. In our office itself, now we've had cases where young guys in their 30s, they're getting strokes and stuff like that. So why is this happening for people under 40s? What should we look out for? So if you could give me a little bit.
First of all, thank you very much for giving me this opportunity to talk to you. See, stroke has always been the number 3 killer in the country. Okay. And it is the worst thing about stroke is that it causes a lot of disability and mortality as well. So stroke needs to be seen as an emergency always. Now, the classical causes of stroke were hypertension, diabetes, smoking, sedentary lifestyle, lipids. These were the earlier causes. But there are new causes which are coming in young stroke. We have something called young stroke in young, which is less than 30 years, 40 years, like that. Now, there we are finding that there are many other things which are causing it. For example, there is a blood component called homocysteine. Rise in homocysteine causes clots, clot formation. Then there are other procoagulant factors. Procoagulant factors means those which promote coagulation in the blood vessels. Now, there's protein CS, protein C, protein S deficiency, and apolipoprotein. All these can cause clots in the brain. Now, these were not identified earlier, and now we are identifying them. These are newer risk factors which have come in. Then there may be a small hole in the heart which has not been detected earlier. We found that many people have that. There's called a PFO, perforated foramen ovale. That can also cause a lot of stroke. Then the sedentary lifestyle and also neck massages. I want to highlight this. People undergo a lot of neck massages at their barbershop, and that can cause what we call as a dissection of the carotid artery. What happens is the artery has got it's got a wall. Now, if there is a breach in the wall, the blood enters that wall and there's no blood supply distally. That means upwards towards the organ. So that can also cause stroke.
Plus, you don't get to know when the massage is happening?
You get to know, but by the time this happens, we can't get to know because we take the history properly. So a lot of strokes are happening because of these reasons also.
Namaste, Jai Hind. You're watching ANI podcast with Smita Prakash.
अगर हम उसको मस्जिद कहेंगे तो फिर विवाद होगा.
The issue is टूटा है क्या भारत?
400 पार का मतलब ये है कि संविधान खतरे में है.
क्या हम लोग ये निर्देश देते हैं कि फला को गिरफ्तार करके जेल डाल दें?
वही तो कह रहे हैं सब.
ये बेबुनियाद निराधार आरोप.
सच्चा सुनना चाहो देखो स्मिता प्रकाश ANI. It does not lie.